tetanus. But there is a very good relationship between animal and tetanus, which scientific explanation is a bit vague and blurred.
All right, Mr. Josam. Listeners, in case you're just joining us, and in today's episode, we are discussing tetanus. Mr. Josam, our guest, is the one who is taking us through this medical condition. Mr. Josam, now, what are the risk factors of this medical condition?
Yeah, as I said, tetanus being a condition, every condition has got its risk factors, or what we call predisposing factors. Yes. Number one of the predisposing factors to tetanus is unvaccinated or undervaccinated individual. You recall, as I was saying about neonatal tetanus, I said if the mother has not completed the dose of tetanus toxoid vaccine, which is well-scheduled one, the baby might have the chance of getting the tetanus. That's what we call undervaccinated. Okay. And the only unvaccinated is the individual who was born but has never received any tetanus vaccine. Those people are predisposing themselves to be those people who can easily catch the tetanus. Why? This tetanus being a bacterial infection, but most of the time the drug for it is a bit difficult. Why? So it is very, very, very rapid, or we can say it is a fulminant condition. It progresses very rapid one. So the antibodies cannot work on it. What we need to do is just to vaccinate the individual to prevent the majority of the people. So if the person has never been receiving vaccine or has been under-vaccinated, the chances are there that this individual might catch the tetanus. Poor wound care. I put it already on transmission that where there is contaminated wounds, we need to handle it with very much care, because these guys, the spores of Clostridium tetani, they like to stay or to live in this kind of areas. So if the medical practitioner or someone else who is taking care of the wound hasn't taken care of the clear, it shall end up rebuking against the person who is taking care of it. So that's what we call now the individual is predisposing him or herself of catching the tetanus. Another thing is contaminated equipment. I put it already there that when you are using whichever equipment in the medical situation, make sure that equipment must be well sterilized. If that equipment it has happened that it is contaminated with Clostridium tetani spores, and you are using to someone else who is clean, but you pierced that individual, the chances of spores to get into the system is very high, because these are microorganisms. They are very, very small with a diameter which we can say is 0.0 micrometers, which you can easily pierce in the body system. As such, the chances of piercing or protruding in the body is very high, and you can easily catch it if that equipment hasn't been well sterilized. Another risk factor is agricultural construction works. If you can see all areas there, we are supposed to encounter the dirty. Dirty shall mean soiled or something else which is fecal one. In a construction, like when you are doing plumbing, you expect the fecal matter. The plumber one, those plumber guys, they always handle the fecal matter. Agriculture guys, they always handle soiled matter. So I said that Clostridium tetani likes to stay in dirty areas as well as fecal matter. So if you are always working on this area, make sure you protect yourself from not much more come in contact with those matters, so that you can at least lessen the chance of being at the predisposing point. Okay. Another area of being risky is the travel to endemic area. Endemic area shall mean, for example, in Malawi, we have got the measles cases in Neno. Neno is endemic area for tetanus for sure. So those, if you travel to that area, make sure you follow all modalities that will not predispose you to catching tetanus. So when you travel there, it is at owner's risk. Of course, medical cares are given that when there is tetanus, don't do this, follow this, all modalities are given. However, there are other people that they tend to not to support whatever has been given. Those guys, they are at the chances of getting tetanus. That's what I can say about the risk factors.
Okay. After looking at the risk factors now, what are the complications now? What are the complications after these risk factors? Are there any complications?
A lot of complications arise from tetanus. As I said, tetanus, it always attacks the what we call the musculoskeletal system. And this musculoskeletal system entails all other systems again, which again, musculoskeletal plays a very big role in as far as anatomy and physiology is concerned. So this will complicate it to respiratory failure. Respiratory failure, why? There is cardiac, what we call the spasmodynamics of the what? Spasmodynamics of the muscles, rigidity of the muscles. So complication there as follows: respiratory failure, number 1. Number 2, cardiac arrest. Number 3, pneumonia. Number 4, septicemia, and you can die. If you see all those 5 areas, it is attacking the muscles of every system. Respiratory, that means the lung, which the muscles that control the lung are being attacked. Cardiac arrest, that shall mean the heart muscles are being attacked. Pneumonia, similarly, pneumonia goes with respiratory. That means the bronchi, alveoli, and all other muscles that attack, that controls the respiratory system is being attacked. Septicemia is being defined as presence of bacteria in the blood. When there is a bacteria in the blood, it doesn't mean that the person is suffering from any bacterial infection. But when it is there, it is what we call septicemia. So when there's septicemia, we expect nothing but the full blood count from the laboratory will give us high WB or high counts of white blood cells that shall entail the antibodies are playing against the foreigner. Foreigner shall mean Clostridium tetani spores. Now you can die. Mortality rate is 10 to 6%. That means in a 10 to 100 or 60 of 100 individual might die because of this infection. This might result from the above said as I put it. That's what I can say about the complication.
All right, Mr. Josam. I hope this medical condition has also preventive measures. Now, what are these, if there are some?
And basing on what I've been explaining above, there is simple and straightforward. Number 1 prevention measure of this tetanus is vaccination. You need to be vaccinated following the schedule of the vaccine. In this case, we are talking of tetanus toxoid vaccine, which is given to the baby, number 1. And it should be given to the expecting mother, depending on the dosage as prescribed per every country. Every country has got its own dose. Then we need to have a proper wound care, as I said already. These guys, they like to stay on the dead area. So we need to properly take care of the wound. We following all aseptic technique and as well as infection prevention control measures must be well placed. Number 3 prevention is cleaning and disinfecting equipment. Make sure all the equipment that we are using in all hospital setup as well as home site must be well cleaned and disinfected. Disinfection shall entail sterilization or disinfection of its own. Because disinfection and sterilization is 2 different things. Disinfection, we can use alcohol or other reagents or other chemicals. However, sterilization will use the heat at a very high temperature so that every organism, every virus can die. So those are the difference. Then again, we need to avoid contaminated soils or fecals. As I said already, that these guys, they like to live in the dirty areas. So we need to avoid those kind of things. When we are doing it, we need to make sure that we are safe enough in all those kind of environments whereby we are not going to transmit or we are not going to catch anything pertaining to tetanus.
As we are going to an end of this program, Mr. Josam, is there any treatment for this disease?
Treatment, as I said, in this condition, of course, bacterial infection, they are always curable, but because it's a feminine, it will be very difficult. So antibiotics are prescribed, number one. Number two, there is supportive care, whereby we support the patient psychologically, emotionally, and physically. Number three is muscle relaxant. We need to relax the muscles. Where they are rigid, we need to relax them by the increasing range of motion. Then you have to give what we call immunoglobulin, what we call them tetanus immunoglobulin TIGs. And again, we need to clean the wound. And probably we can do debridement at the theater. And there's immediate medical attention where necessary. The patient has come in the coma state or in the emergency state.
All right. Can you tell us about the vaccination schedule?
Yeah, for sure, this condition much more well responded or much more prevented with vaccination schedule. The first vaccine that is given to tetanus is what we call the DPT. DPT shall mean diphtheria tetanus pertussis vaccine. It is given. Those are abbreviations that we use at the hospital. Then DPT number one. Then if you give the patient that DPT, we can give again as a booster, DPT again, and it comes as a booster. So we control the three diseases, tetanus, diphtheria, and pertussis, because these diseases, most of the time, they present the very same complaints. Recommended schedule, we can give it at 2 to 4 months, or up to 6. Then from there to 15 up to 18 again, or we can give it from 4 to 6 years, even 11 to 12 years. However, we can still give it above those kind of ages depending on the presentation of the individual as well as the pandemicity as well as endemicity of the condition. Those are the areas that we needed to cover as far as tetanus is concerned.
That's all we had in today's program. Let me thank you once again, Mr. Josam, for coming into this program to tell us more about tetanus. Our listeners, I think we are getting something from these programs. Let's meet again in the next episode, whereby Mr. Josam will be taking us to another medical condition. You were with me, Liveness Choka, the producer and the editor of the program. Till next time, bye.